for a look at the different options offered by Momentum Health.
Everyone has different needs when it comes to healthcare, be it doctor visits, chronic medication, or hospitalization. For example, some people want to be covered for the full spectrum of healthcare expenses, while others need cover for hospitalization only. Whatever your needs, Momentum Health can provide an option to suit your priorities and your budget.
First, the Ingwe Option.
The Ingwe Option is designed for members who are looking for affordable entry-level or basic cover. For hospitalization cover, you can choose to use either any hospital, the Ingwe network of private hospitals, or state hospitals. There is no overall annual limit for hospitalization. In-hospital specialist accounts are covered at up to 100% of the Momentum Health rate. The Ingwe Option's chronic benefit covers 26 chronic conditions. Chronic medication and basic day-to-day benefits like GP visits, dentistry, and optical benefits are provided by the Ingwe Primary Care Network or the Ingwe Active Primary Care Network of healthcare providers. You can get a list of these providers by logging on to the Momentum Health website.
The Health Platform benefit provides cover for a range of preventative care benefits available from your Ingwe primary care provider. And if you need more day-to-day benefits, you can opt for the Health Saver. Health Saver is a complimentary product offered by Momentum that lets you save for additional medical expenses. The Impact Option offers private hospitalization with cover for in-hospital specialist accounts at up to 100% of the Momentum Health rate. Hospitalization is covered in the Impact Network hospitals. No overall annual limit applies. The chronic benefit covers 26 chronic conditions with treatment and medication supplied by the state. Basic day-to-day benefits such as GP visits, dentistry, and optical benefits are available from the Impact primary care providers. The first 10 GP visits per beneficiary per year are covered in full, and a co-payment applies from the 11th visit onwards. The Health Platform benefit provides cover for a range of preventative care benefits available from Impact primary care providers. And if you need more day-to-day benefits, you can take the Health Saver. The Health Saver is a complimentary product offered by Momentum that lets you save for additional medical expenses. The Custom Option provides cover for hospitalization at private hospitals. There is no overall annual limit for hospitalization. You can choose to have access to any hospital, or you can choose to receive a discount on your contribution by selecting to use a specific list of private hospitals called associated hospitals. You can get a list of these associated hospitals from your financial advisor by logging on to the Momentum Health website or consulting your Momentum Health member brochure. In-hospital specialist accounts are covered at up to 100% of the Momentum Health rate.
If you use Momentum Health's associated specialists, the specialist will charge according to your option rate, and you will not have a co-payment on the specialist account. On this option, you need to pay a co-payment of 1,500 Rand when you are admitted to hospital or have a specialized procedure, except for motor vehicle accidents, maternity confinements, or emergency treatment. An additional co-payment may apply per authorization for certain specialized procedures. The chronic benefit covers 26 chronic conditions, and you can choose to get your chronic treatment from one of the 3 chronic providers, any, associated, or state. You can find further details about the list of conditions in your Momentum Health member brochure. The Health Platform benefit provides cover for a range of preventative screening tests and certain checkups. For cover of day-to-day expenses like GP visits or prescribed medicine, you can choose to make use of a voluntary complementary product from Momentum called the Health Saver. It is an additional savings facility that gives members a choice on the level of savings they wish to contribute, based on their individual needs and budget. Members on the incentive option have cover for hospitalization at private hospitals. No overall annual limit applies. You can choose to have access to any hospital, or you can choose to receive a discount on contributions by selecting to use a specific list of private hospitals called associated hospitals. In-hospital specialist accounts are covered at up to 200% of the Momentum Health rate. By using Momentum Health's associated specialists, charges will be according to the option rate, and there will be no co-payment on the specialist account. There are some specialized procedures and treatment where you will need to pay a co-payment, depending on whether or not the procedure is done in a hospital or doctor's rooms. Please speak to your financial advisor or account executive, or refer to your Momentum Health member brochure for more detail on these procedures. 32 chronic conditions are covered, and your choice of chronic providers is the same as on the custom option. No limit applies to the 26 chronic conditions, which fall under the prescribed minimum benefits. An annual sublimit of 9,800 Rand per family per year applies to the 6 additional chronic conditions covered on this option. The health platform benefit provides cover for a range of preventative screening tests as well as certain checkups. Please refer to the brochure for more detail. 10% of monthly contributions goes into a dedicated savings account to cover day-to-day medical expenses. If you need more day-to-day cover, you can choose to make use of a voluntary complementary product from Momentum called the Health Saver.
Members who choose the extender option have cover for admission to any private hospital, or can choose to receive a discount on contributions by selecting to use a specific list of private hospitals called the Associated Hospitals. No overall annual limit applies. In-hospital specialist accounts are covered at up to 200% of the Momentum Health rate. Momentum Health's associated specialists charge according to the option rate without co-payments on the specialist account.
There are some specialized procedures and treatment where you will need to pay a co-payment, depending on whether or not the procedure is done in a hospital or doctor's rooms. Please speak to your financial advisor or account executive, or refer to your Momentum Health member brochure for more detail on these procedures. The chronic benefit is extensive, covering 62 chronic conditions, and the choice of chronic providers is the same as on the custom and incentive options. No limit applies to the 26 chronic conditions which fall under the prescribed minimum benefits. An annual sublimit of 9,800 Rand per family per year applies to the 36 additional chronic conditions covered on this option. The health platform benefit provides cover for a range of preventative screening tests and certain checkups. Please refer to your Momentum Health member brochure for more detail.
As with the incentive option, the extender option pays for day-to-day expenses from the savings account. On the extender option, 25% of the monthly contribution goes to your savings account. The difference with the extender option, as the name suggests, is if additional cover for day-to-day expenses is needed, the option will then provide extended cover after a threshold has been reached. How does extended cover work? The threshold is a fixed Rand amount based on your family size. Members on the extender option have a self-funding gap before the threshold is reached. This means a portion of day-to-day claims up to a predetermined Rand level needs to be funded from your own pocket, after which the scheme will pay for day-to-day benefits from extended cover. The complementary product from Momentum called Health Saver is an ideal way of filling the gap and enjoying uninterrupted cover for day-to-day expenses, like visits to the dentist as well as medicine from the pharmacy.
Members can choose at what rate claims must be paid for day-to-day expenses. If claims are paid at 100% of the Momentum Health rate, savings will not deplete faster when a provider charges above the Momentum Health rate, and the self-funding gap will not increase during the year.
The disadvantage is that there may be co-payments on claims that exceed the accumulation rate. If claims are paid at the cost of the claim limited to 200% of the Momentum Health rate, the advantage is that there won't be a co-payment as long as there are funds available in your savings account. The disadvantage is that your savings will deplete faster when a provider charges above the Momentum Health rate, and your self-funding gap may increase during the year. Extender option members also need to take note that if you choose the associated chronic provider option, you need to use an associated GP for your day-to-day and health platform visits too. The Summit option provides comprehensive cover for total peace of mind. Members who choose the Summit option have cover for hospitalization at any private hospital. No overall annual limit applies. In-hospital specialist accounts are covered at up to 300% of the Momentum Health rate. If Momentum Health's associated specialists are used, they will charge according to your option rates, and there will be no co-payment on the specialist account. This option provides an extensive chronic benefit, covering 62 chronic conditions and the freedom to obtain chronic scripts and medication from any provider. No annual limit applies to the 26 chronic conditions under the prescribed minimum benefits. The 36 additional chronic conditions covered on this option are subject to the overall day-to-day limit per beneficiary per year.
Extensive day-to-day benefits are available from any provider, subject to sublimits on certain benefits. Day-to-day claims are also subject to the overall out-of-hospital limit of 24,700 Rand per beneficiary per year. The health platform benefit provides cover for a range of preventative screening tests, certain checkups, and more. Please refer to your Momentum Health member brochure for more detail.
Please bear in mind that if you join Momentum Health after the 1st of January, benefit limits on your options will be reduced in line with the number of months remaining in the year. This applies to all the Momentum Health options.
The next 3 slides show the Momentum Health options in terms of level of cover, limits, and providers for the major medical, chronic, and day-to-day benefits. Cover for major medical expenses ranges from 100% of the Momentum Health rate to as high as 300% of the Momentum Health rate on the Summit option. Hospital providers can be chosen on the Ingwe, Custom, Incentive, and Extender options. This choice allows you to save on your monthly contributions. Please note that on the Custom option, a co-payment of 1,500 Rand applies per authorization, except if you're admitted to hospital in the case of an emergency, motor vehicle accidents, and maternity confinements. A co-payment may also apply to a list of specialized procedures and treatment on the Custom, Incentive, and Extender options. Please consult your member guide for more details.
Chronic benefits are subject to registration and approval. The 26 prescribed minimum benefit chronic conditions are covered on all options. The Incentive, Extender, and Summit options offer cover for additional chronic conditions subject to annual limits. The chronic provider chosen determines the monthly contribution, as well as where you can get your chronic scripts and medicine.
Day-to-day benefits on the Ingwe and Impact options are provided by primary healthcare provider networks.
On Custom, all day-to-day benefits need to be self-funded, with the exception of the day-to-day screening benefits covered by the health platform. Members can choose to add the Health Saver, a voluntary complementary product offered by Momentum. The Incentive option provides a fixed percentage of savings from which day-to-day benefits are paid. If this is not sufficient, members can choose to add the Health Saver. The Extender option also offers a savings account, and after the threshold is reached, further extended cover is funded by the scheme. The Summit option covers day-to-day benefits from risk, subject to an annual day-to-day limit.